Time for another episode of what artists therapists can learn from. And today we are learning from Robert Irwin and this wonderful book, Seeing is Forgetting, the name of the thing one sees. Over 30 years of conversations with Robert Irwin by Lawrence Weschler. Must read. Anyway, let's talk about Robert Irwin. Robert Irwin's work challenges a deeply ingrained habit in both art and therapy, the urge to name, categorize, and explain experience as quickly as possible. His famous phrase, seeing is forgetting the name of the thing one sees, is not an intellectual stance, but a call to suspend premature meaning making. Irwin was less interested in objects than in conditions: light, space, duration, scale, attention. His installations do not instruct viewers what to think or feel. Instead, they reorganize the space so perception itself changes. The artwork happens in the encounter, not the explanation. Therapy often privileges insight, interpretation, and diagnosis. While naming can be useful, Irwin's work reminds us that transformation does not always begin with language. Sometimes change emerges through reorientation, through subtle shifts in atmosphere and pacing, and what becomes noticeable in the room. From this perspective, the therapist is not only a conversational partner, but a designer of space time. The therapeutic encounter becomes a carefully held environment where new perceptions and eventually new stories can arise. Irwin's practice resonates strongly with approaches to therapy that emphasize liminal space and the role of time, like my practice. His installations slow people down. They ask for patience, attentiveness, and presence. Meaning unfolds gradually, often below the level of conscious interpretation. In therapeutic work, this suggests that not all movement is narrative at first. Some shifts are atmospheric. Some futures are rehearsed through inhabiting a different tempo or a different spatial arrangement before they are ever spoken out loud. Beyond his specific artworks, Robert Irwin offers an ethic of a creative life that is deeply relevant to therapists, and this is what I found really helpful for me. He approached creativity as a lifelong discipline of attention rather than a pursuit of products, recognition, or fixed identity. Irwin was willing to abandon successful styles, erase earlier work, and begin again when his perception changed. This required humility, patience, and a tolerance for uncertainty, qualities that mirror the demands of a meaningful therapeutic practice. For therapists, Irwin's life suggests that creativity is not an add on professional competence, it's a way of being in the world, staying open, remaining teachable, and allowing one's work to evolve as perceptions deepen. Therapy is not only about changing stories, it's about changing the conditions under which stories become possible. Artists like Robert Irwin understood this long before it entered the psychological language. Peace.